I've been here just over 2.5 months, and I think the benefit is that I've had a good opportunity to have a look at Canberra Health Services, especially in its new iteration as our own directorate and health service. There's lots to do here. I of course had to go through a process, and that process was undertaken in recent weeks. And prove that I was worthy of the job and that I was the right choice. There's a lot of great opportunity here at Canberra Health Services, and I just need to keep stressing that there are great people here. They are so hardworking and dedicated, and being given the opportunity to lead them is fantastic. When I started here, I was told this is not caretaker, get started. So nothing's really changed. We have a focus on really about timely access is our first priority, and improving our performance in that area. I've started a working group, and we've been meeting with 40 staff members from across the organisation to look at occupational violence, which is an increasing issue not just for us but for all jurisdictions across Australia and internationally as well. And really working with the organisation early next year, we'll be working on what's our vision for Canberra Health Services, what are our behaviours that we value going forward, and then we'll develop a strategic plan going forward. So I think it's about getting the organisation focused together. So with the CEO role, there's not been a Chief Executive Officer role before to lead the organisation and to make those decisions on the ground in a quick and agile way. So that's a big change and a big improvement. It's about bringing the executive team together and the rest of the organisation to really look at performance. But also too, I come with a different perspective. I come from a different jurisdiction. I've seen lots of innovations and improvements that work in timely care and improving access to care across the organisation. So I can put a different lens and different solutions, but also to expose my clinicians and my executive to other solutions from other jurisdictions, get them out and looking to see what we can do differently. But it's also about bringing that the organisation together, consulting with staff and the staff on the ground. They often have the solutions. We've just got to listen to them and give them the power to actually make change. ED performance, funnily enough, isn't just dependent on what happens in the emergency department. It's actually dependent on how quickly we move people through the organisation and across the organisation. The biggest challenge really is actually focusing everyone's efforts in the right places and actually fixing some of those systems and processes across the organisation that actually aren't streamlined as much. It's about removing frustrations for staff and patients of some of the systems and processes, and getting, I guess, a coordinated approach to that across the organisation, and getting people to, I guess, trust and to speak up, and to and knowing that we will listen and we will take action, and that we're all in this together, and we need to work as a team to improve our performance.